12 reasons why you lose balance after 60. Have you ever wondered why it's so common to see older adults struggling with balance? Or what exactly happens to our bodies as we age and lose this essential ability? Balance is something many of us take for granted, but it's supported by a complex system of coordination between the senses, muscles, and brain. Is it just natural aging, or are there other hidden factors contributing to this loss of balance? As the years go by, our ability to maintain balance can be impaired by various reasons, from decreased visual acuity to muscle weakness and neurological problems. What exactly can we do to prevent falls and maintain our mobility? Discover how to identify signs of balance problems and explore effective techniques to improve stability, strengthen muscles, and enhance proprioception. After all, what can we do today to ensure a safer and more active future? Stay with us until the end, because reason number 11 is the most dangerous, and almost no one knows about it. Important. We have listed all the references used to create this video in the description for you to access whenever you want. Let's begin. Why does balance deteriorate with age? Balance deteriorates with age due to a combination of physiological and neurological factors. As we age, there is a natural degeneration of sensory, motor, and cognitive systems. The vestibular system, located in the inner ear and crucial for maintaining balance, deteriorates, reducing sensitivity to position and movement. Additionally, vision, which also contributes to balance, can be affected by conditions such as cataracts and macular degeneration. Muscles and joints also weaken, diminishing the body's ability to respond quickly and efficiently to imbalances. The central nervous system, responsible for processing sensory information and coordinating motor responses, can become less efficient, affecting the ability to maintain balance. These changes increase the risk of falls and injuries in older adults, highlighting the importance of strength and balance exercises to minimize these effects. 12 reasons why you lose balance after 60. 12. Sedentary lifestyle, the silent danger that steals your mobility. A sedentary lifestyle is a major enemy of health, especially after age 60. As we age, the lack of regular physical activity can lead to a range of problems affecting balance and mobility. The human body is designed to move, and prolonged inactivity can result in muscle mass loss, flexibility, and endurance. This happens because muscles that are not used regularly tend to atrophy, becoming weaker and less able to support the body adequately. Additionally, a sedentary lifestyle contributes to weight gain, which can overburden joints and bones, increasing the risk of falls. Lack of exercise also affects the cardiovascular system, reducing the efficiency of blood circulation and decreasing the body's response to position changes, such as standing up quickly. Therefore, staying active is crucial for preserving mobility and balance. Regular walks, stretching, and muscle strengthening exercises are essential to combat the effects of a sedentary lifestyle. Adopting an active lifestyle not only improves balance but also promotes a better quality of life, allowing older adults to maintain their independence and enjoy daily activities with more safety and confidence. 11. Vitamin B12. Deficiency, the essential nutrient. You may be missing. Vitamin B12 is essential for the proper functioning of the nervous system and the production of blood cells. With age, the absorption of this vitamin may decrease, leading to a deficiency that often goes unnoticed. Vitamin B12 deficiency can cause a range of symptoms that affect balance and coordination, including numbness and tingling in the hands and feet, gait difficulties, and even memory and concentration problems. This is because vitamin B12 is crucial for the maintenance of myelin, a protective layer surrounding nerves. Without it, nerves can become damaged, impairing communication between the brain and the rest of the body. Additionally, B12 deficiency can lead to anemia, a condition that reduces the number of red blood cells in the blood, compromising oxygen transport to tissues, and causing weakness and fatigue. Older adults are particularly vulnerable to this deficiency due to dietary changes, the use of certain medications that interfere with B12 absorption, and health conditions such as atrophic gastritis. Therefore, it is important to regularly monitor vitamin B12 levels and consider supplementation or dietary adjustments, including B12-rich foods like meat, fish, eggs, and dairy. Consulting a healthcare professional for evaluation and guidance is essential to prevent complications associated with this deficiency. 10. Dehydration, the small oversight with big consequences. Dehydration is a common problem that can have serious consequences for older adults, including loss of balance. With age, the sense of thirst diminishes, which can lead to insufficient fluid intake. Additionally, some medications and health conditions, such as kidney problems and diabetes, can increase the risk of dehydration. Water is essential for maintaining blood volume, regulating body temperature, and ensuring the proper functioning of muscles and joints. When the body is dehydrated, blood volume decreases, which can lead to a drop in blood pressure and the sensation of dizziness or vertigo, especially when standing up quickly. This increases the risk of falls, which can be particularly dangerous for older adults. Additionally, dehydration can cause mental confusion, fatigue, and weakness, further affecting stability. It is crucial to drink water regularly throughout the day, even without feeling thirsty, and include water-rich foods in the diet, such as fruits and vegetables. Avoiding alcoholic and caffeinated beverages, which can contribute to dehydration, is also important. Staying well hydrated is a simple but effective measure to protect health and balance. 9. Diabetes, the hidden side that affects your feet and balance. Diabetes is a chronic condition that can significantly impact balance, especially when not well controlled. One of the main issues related to diabetes is peripheral neuropathy, which is damage to the nerves in the feet and legs. This can result in decreased sensation, pain, tingling, and weakness, making it difficult for individuals to feel their feet and, consequently, maintain balance. Additionally, diabetes can cause blood circulation problems, leading to poor healing and increased infection risk, further exacerbating foot problems. Hyperglycemia, or elevated blood sugar levels, can also cause changes in vision and cognitive processes, affecting spatial perception and coordination. For older adults, who may already be dealing with other factors compromising balance, these additional issues can significantly increase the risk of falls. It is essential for people with diabetes to maintain strict blood sugar control, practice regular foot care, and wear appropriate footwear. Regular consultations with an endocrinologist and a podiatrist are recommended to prevent and treat complications, thereby protecting balance and mobility. 8. Hypertension, the hidden cause of dizziness when standing up. Hypertension, or low blood pressure, is a condition that can go unnoticed but significantly affects balance, especially when standing up. When blood pressure is low, the blood flow to the brain can be insufficient, leading to symptoms such as dizziness, fainting, and blurred vision. This is particularly dangerous when changing positions quickly, such as standing up from a chair or bed, a condition known as orthostatic hypotension. This phenomenon is common in older adults due to a natural decrease in the body's ability to regulate blood pressure with age and can be exacerbated by medications, dehydration, or prolonged periods of rest. Hypertension can not only cause falls, but also contribute to a general feeling of weakness and instability. To manage this condition, it is important to adopt measures such as getting up slowly, avoiding sudden position changes, staying well hydrated, and, in some cases, adjusting medication under medical supervision. Additionally, wearing compression stockings can help improve blood circulation. Consulting a doctor for proper evaluation and diagnosis is crucial to implement an effective treatment plan and prevent complications. 7. Medications, the surprising side effect you didn't expect. Many older adults take multiple medications to manage various health conditions. However, some of these medications can have side effects that affect balance and coordination. Medications for high blood pressure, antidepressants, anti-anxiety medications, and even some pain relievers can cause dizziness, drowsiness, or orthostatic hypotension, increasing the risk of falls. The use of multiple medications, known as polypharmacy, can exacerbate these effects, especially when the drugs interact with each other. Additionally, sensitivity to medications can increase with age due to changes in how the body processes and eliminates substances. It is essential for older adults and their caregivers to be aware of the potential side effects of medications and monitor any changes in symptoms. Keeping an updated list of all medications, including supplements, and regularly reviewing this list with a doctor or pharmacist can help identify potential problems. In some cases, dosage adjustments or medication changes may be necessary to minimize risks. Medications should never be discontinued without medical guidance, as this can worsen the underlying health condition. 6. Inner ear problems. How vestibular issues can destabilize you. The vestibular system located in the inner ear is crucial for controlling balance and spatial orientation. Problems with this system, known as vestibular disorders, can cause vertigo, dizziness, and imbalance, affecting a person's ability to move safely. Disorders such as benign paroxysmal positional vertigo, BPPV, labyrinthitis, and Meniere's disease are common among older adults and can be triggered by a variety of factors, including infections, trauma, or changes in the inner ear due to aging. Symptoms of vestibular problems can include the sensation that the environment is spinning, difficulty focusing vision, and a general sense of instability, which can be exacerbated by rapid head movements. This not only increases the risk of falls, but can also cause anxiety and avoidance of activities that require balance, such as walking on uneven surfaces. Treatment may include canalith repositioning maneuvers, vestibular rehabilitation exercises, and, in some cases, medications to control symptoms. Consulting an otolaryngologist or a specialist in hearing and balance is essential for proper diagnosis and treatment. 5. Neurological surprises. When the brain impairs balance. The brain plays a central role in maintaining balance, processing sensory information from the eyes, ears, and body to help coordinate movements. Neurological conditions such as Parkinson's disease, stroke, and multiple sclerosis can affect this function, resulting in balance and coordination problems. Parkinson's disease, for example, causes muscle rigidity, tremors, and slow movements, making it difficult for the body to respond quickly to position changes or to maintain a stable posture. Strokes can damage areas of the brain responsible for motor control and balance, leading to muscle weakness, loss of coordination, and difficulty walking. Multiple sclerosis, which affects the myelin sheath of nerves, can cause a wide range of symptoms, including balance problems, weakness, and fatigue. These neurological disorders not only increase the risk of falls, but can also affect a person's confidence in performing daily activities. Treatment may involve medication, physical therapy, and in some cases, surgical interventions to improve motor function and stability. It is crucial for individuals with these conditions to receive ongoing medical support and make lifestyle adjustments to manage symptoms and maintain quality of life. 4. Rusty joints? How this can hinder your daily life. As we age, it is common to experience joint stiffness and pain, a condition often associated with osteoarthritis. This rusting of the joints can limit the range of motion and affect balance, making daily activities like walking, climbing stairs, or even getting up from a chair more challenging. Osteoarthritis occurs when the cartilage that cushions the ends of the bones wears down, leading to pain, swelling, and stiffness. This can be particularly problematic in weight-bearing joints, such as the knees and hips. Loss of mobility and pain can cause people to avoid movement, which paradoxically can worsen the situation, as movement is essential for maintaining joint health and muscle strength. Additionally, improper use of certain joints due to pain can lead to compensatory movement patterns, which can cause muscle imbalances and increase the risk of falls. Treatment for osteoarthritis may include medication for pain relief, physical therapy to improve strength and flexibility, and in some cases, surgery. Maintaining a healthy weight, practicing low-impact exercises, and using assistive devices, such as canes, can also help manage symptoms and improve mobility. 3. Muscle weakness, the invisible challenge to your stability. Muscle weakness is one of the main causes of balance loss among older adults. Over the years, there is a natural decrease in muscle mass, known as sarcopenia, which can significantly affect the ability to move and maintain stability. Weak muscles do not provide adequate support to the joints and skeleton, increasing the risk of falls. Additionally, muscle weakness can affect posture, causing misalignments that make balance more difficult. Lack of strength in the leg and core muscles, in particular, can compromise the ability to get up from a chair, climb stairs, or walk safely. This not only reduces mobility, but can also lead to greater dependence on others for daily activities. The good news is that muscle weakness can be combated with specific strengthening exercises. Exercise programs that include resistance training, such as using weights or resistance bands, as well as balance exercises, are highly recommended for older adults. Staying physically active and incorporating regular activities that strengthen muscles can significantly improve balance, coordination, and overall quality of life. 2. Hearing loss, the silent enemy of your balance. Hearing loss is a common condition that can affect balance, especially in older adults. The auditory system not only allows us to hear, but also plays a crucial role in our spatial orientation and the ability to maintain balance. The inner ear, where the auditory and vestibular organs are located, sends information to the brain about head movement and body position. When hearing is compromised, the sensory input that helps maintain balance can be affected, increasing the risk of falls. Additionally, hearing loss can make it difficult to perceive environmental sounds, such as footsteps or approaching objects, which are important for safely navigating the environment. This can lead to a sense of isolation and decreased confidence in performing daily activities. Hearing loss is also associated with decreased cognitive function, which can exacerbate balance problems. It is essential for older adults to have regular hearing tests and, if necessary, use hearing aids to improve hearing. These devices not only help with better hearing, but can also contribute to improved balance and safety when walking. 1. Declining vision. What you don't see can hurt you. Vision plays a crucial role in maintaining balance, helping us perceive the environment around us and navigate safely. As we age, it is common to experience a decrease in visual acuity due to conditions such as cataracts, age-related macular degeneration, or glaucoma. These conditions can limit the ability to see clearly, distinguish colors and contrasts, and detect obstacles or changes in surface texture. This can lead to an increased risk of falls, especially in poorly lit or unfamiliar environments. Additionally, vision problems can affect the ability to perceive depth and distance, which is crucial for activities such as climbing or descending stairs or walking on uneven terrain. Adaptation to light can also be slower, meaning that sudden changes in lighting can temporarily obscure vision. To minimize the impact of visual loss on balance, it is important to have regular eye exams and use glasses or contact lenses with the correct prescription. In some cases, surgery may be necessary to treat conditions such as cataracts. Maintaining good lighting at home and eliminating obstacles that could cause falls are also important measures to ensure safety. What are the signs of balance problems? 1. Blurred vision. Blurred vision is an important sign of balance problems because vision plays a crucial role in spatial orientation. When the eyes do not provide clear and accurate information to the brain, it can be difficult to maintain balance. Conditions such as cataracts, glaucoma, or uncorrected refractive errors, the need for glasses, can cause blurred vision. Additionally, blurred vision can be a symptom of more serious conditions, such as strokes or neurological disorders, that affect the vestibular system and body balance. Consulting an ophthalmologist is essential for proper diagnosis and treatment. 2. Confusion. Mental confusion can indicate balance problems, especially when associated with other medical conditions. Confusion can arise due to decreased cerebral blood flow, lack of oxygen, or side effects of medications. This condition can affect the ability to process sensory information, including those needed to maintain balance. In severe cases, such as strokes or neurological disorders, confusion can be accompanied by memory loss, difficulty concentrating, and disorientation. It is important to seek medical evaluation to identify the underlying cause and receive appropriate treatment. 3. Diarrhea. Diarrhea, although not commonly associated with balance problems, can cause dehydration, which directly affects body balance. The rapid loss of fluids and electrolytes during episodes of diarrhea can lead to a decrease in blood pressure and reduced blood volume, resulting in dizziness and fainting sensations. These symptoms can compromise a person's ability to stay stable and increase the risk of falls. It is essential to maintain good hydration and, if necessary, consult a doctor to treat the cause of diarrhea and avoid major complications. 4. Dizziness and vertigo. Dizziness and vertigo are clear signs of balance problems. Dizziness is a sensation of lightheadedness or impending fainting, while vertigo is the sensation that the environment is spinning or moving even when the body is stationary. These sensations can be caused by inner ear disorders, where the vestibular system is located, or by neurological problems. Other causes include changes in blood pressure, dehydration, and side effects of medications. Dizziness and vertigo can be debilitating and significantly increase the risk of falls, requiring immediate medical evaluation. 5. Fear, panic, and anxiety. Fear, panic, and anxiety can exacerbate or even cause balance problems. These psychological conditions can trigger physical responses, such as increased heart rate, rapid breathing, and muscle tension, which affect the vestibular system and the sense of balance. The fear of falling, for example, can lead to rigid posture and hesitant movements, further compromising stability. Additionally, hyperventilation, common in panic attacks, can cause dizziness and fainting sensations. Treatment may include cognitive behavioral therapy, medication, and relaxation techniques to help manage these symptoms. 6. Sensation of falling. The sensation of falling, even in the absence of movement, is a sign that the vestibular system or other parts of the body responsible for balance are compromised. This sensation can be triggered by problems in the inner ear, where the vestibular system is located, or by neurological conditions that affect the perception of the body in space. People with this sensation may feel as if the ground is moving or as if they are being pulled to one side. This not only causes discomfort, but also increases the risk of real falls. A medical evaluation is essential to determine the underlying cause. 7. Feeling dizzy, fainting. Organ floating. Feeling dizzy, as if fainting or floating, is a common symptom of balance problems. These sensations can result from a variety of factors, including low blood pressure, hypoglycemia, dehydration, or inner ear disorders. They can occur suddenly and are often associated with a decrease in blood flow to the brain, which can happen when standing up quickly or in situations of extreme heat. These sensations are warning signs that indicate the need for medical evaluation to prevent falls and other accidents. 8. Changes in blood pressure. Changes in blood pressure, both increases and decreases, can affect balance. Orthostatic hypotension, a sudden drop in blood pressure when standing up, can cause dizziness, blurred vision, and fainting sensations, increasing the risk of falls. On the other hand, hypertension can damage blood vessels and reduce blood flow to the brain, compromising cognitive function and balance. Medications, dehydration, and underlying health conditions such as heart disease can contribute to these changes. Monitoring and managing blood pressure is crucial to maintaining balance and preventing falls. How to improve or recover your balance. 1. Muscle strengthening exercises. Muscle strengthening exercises are essential for improving balance, as they increase the strength and stability of muscles, especially in the legs and core. Practicing activities like weightlifting, squats, and resistance band exercises helps build muscle and better support body weight, reducing the risk of falls. 2. Specific balance exercises. Specific balance exercises, such as standing on one foot, walking in a straight line, and using unstable surfaces, like a cushion, help improve coordination and stability. These activities train the body to respond better to position changes and maintain balance in various situations. 3. Yoga or Tai Chi. Yoga and Tai Chi are excellent practices for improving balance and flexibility. These exercises combine slow, controlled